Hello everyone. Today, our group will be explaining about the morphological characteristics and arrangement of cells in liquid-based cytology preparation of patients with endometrial lesions. I will start with the introduction part. Let's take a look at the endometrial carcinoma, which is the most common gynecological malignancy worldwide. One of the major challenges in managing this cancer is that the prognosis significantly worsens with late diagnosis. Stage 1 endometrial cancer has a good outcome, with up to 90% of patients living at least for 5 years. But if the cancer reaches advanced stages, the survival rate drops a lot to between 15 and 65%. Many hospitals still use dilatation and curettage (DNC) as the main procedure to check for endometrial cancer. However, this method is not only invasive and costly, but also causes pain and discomfort to the patient, with a notable risk of infection and uterine perforation. This is why minimally invasive tools like the disposable endometrial sampler is introduced. It allows for simple, painless sample collection without the need for anesthesia. This method helps boosting cell yield and ensuring better patient tolerance. When combined with liquid-based cytology, LBC, this method enhances diagnostic quality, reduces background clutter, and most importantly, preserves cell morphology for accurate evaluation. Cytopathologists now use the standardized systems like the Yokohama system, similar to how the Bethesda system is used for cervical cytology. The study goals we are focusing on today is to evaluate the morphology and also the arrangement of cells in liquid-based cytology preparation. Since this pattern can significantly improve early detection, especially in distinguishing benign lesions, atypical hyperplasia, and cancerous cells. Let's now hear from the next presenter for methods and material.
Next, we go to the methods and materials needed to collect endometrial sample. Why it is difficult to get endometrial cell? Because it is located at the uterine cavity, which is deep in the vagina. ES sampler can make our routine much more easier. We use direct negative pressure suction using disposable endometrial sampler. And the procedure include ES sampler is attached to syringe and then gently insert sampler through cervical os and into uterine cavity. Withdrawn syringe plunger to create negative pressure. Carefully move the sample back and forth, rotating it slightly to collect endometrial tissue. Slowly remove the sampler while maintaining suction and then expel the tissue into appropriate collection container. This is the example on how to collect endometrial sample using ES sampler by Ergonomics Company. For cytological lab, we use liquid-based cytology, surface system, and also Papa Nicolau stain. For the observation of the endometrial cell, we need at least more than 30 epithelial cell cluster, which is equal to 1 cell cluster. To call it satisfactory, we need 10 cell cluster for less than 60 years old and also 5 cell cluster for more than 60 years old. For the diagnostic system, we use the Yokohama system for reporting endometrial cytology. As in the introduction, it is slightly different from Bethesda system in terms of the category. It is specific for endometrial sampling only. And as we can see, it includes TYS0 until TYS6. And for the clinical handling, it includes re-examination, routine medical examination, re-examine using cytological or endometrial tissue biopsy, and also for TYS3 until TYS6, we need to do endometrial tissue biopsy.
Next, we move on to the result. Let's start with the benign endometrial lesion. In this slide, we can see the cytological features of endometrial polyps. For endometrial polyps, the cells are evenly distributed and arranged in flat plates. Morphologically, they are round or oval. with uniform size and equal cell spacing, indicating a benign and orderly cell population. Next, in simple or complex hyperplasia, the cell arrangement is still evenly distributed but now closely packed. The cells remain round or oval and similar in size, but there is noticeable increase in cell number and decrease in spacing due to glandular proliferation. Moving on to atypical hyperplasia, which is a precancerous condition. Here, the cells appear crowded and overlapping, and the typical two-dimensional flat sheet arrangement disappears, showing the beginning of architectural complexity. For the morphology, the nuclei are enlarged, but only within 3 times the size of normal endometrial nuclei. These features suggest atypia, but not yet carcinoma. Now, let's look at the comparison between histological diagnosis, which is the gold standard, and cytological diagnosis. This table illustrates the diagnostic accuracy of cytology in identifying various types of endometrial lesion among 175 cases. For adenocarcinoma, out of 82 confirmed cases of endometrial adenocarcinoma, there are 46 cases were correctly identified cytologically as adenocarcinoma cells. 22 cases were marked as suspected for adenocarcinoma. 10 cases were misdiagnosed as atypical hyperplasia. 4 cases were significantly underdiagnosed as glandular epithelial cell. Next, for atypical hyperplasia, for the 18 histologically confirmed atypical hyperplasia cases, there are 12 cases were correctly identified, but 6 cases were underdiagnosed as benign glandular epithelial cells. Next, simple or complex hyperplasia. For the 34 hyperplasia cases, there are 31 cases were correctly classified as benign, 3 cases were overdiagnosed as atypical hyperplasia. And the last one is endometrial polyps, 41 cases. And among the 41 polyp cases, there are 39 cases were correctly diagnosed as benign glandular cells. Only 2 cases were misclassified as atypical hyperplasia.
Next, we move to the cytomorphological patterns observed in endometrial carcinoma. These carcinoma cells tend to have nucleus enlargement, which is more than 5 times, multi-stage papillary arrangement, where the cells are branching, finger-like projection formed by multiple layers of cells, large and numerous nuclei, large vacuole containing neutrophils in cytoplasm, lobulated arrangement, where the cell cluster have a tendency to differentiate into multiple small cell cluster, while there are still some connection between each cluster, and last but not least, escape cells with elongated nuclei, where the cancer cell that located at the edge of the cluster escapes from the original cell cluster. In order to find the root causes of misdiagnosis of endometrial carcinoma, the carcinoma slides are reviewed again. Out of actual total, which is 82 cases, 17 of the adenocarcinoma cells has more than 5 times nucleus enlargement, 21 cases of multi-stage papillary arrangement consisting 15 adenocarcinoma cells and 6 are suspected for adenocarcinoma cells, 10 cases for large and numerous nuclei consisting 8 adenocarcinoma cells and 2 are suspected for adenocarcinoma cell, 8 cases for neutrophil in cytoplasm consisting 6 adenocarcinoma cells and 2 are suspected for adenocarcinoma cells, 18 cases for lobulated arrangement consisting 12 suspected for adenocarcinoma cells and 6 atypical hyperplasia cells, and lastly, 8 cases for escape arrangement consisting 4 atypical hyperplasia cell and the other 4 is glandular epithelial cell.
The methods that were used are the minimally invasive method that has a broad application in diagnosing adenocarcinoma, while the no auxiliary screening methods for diagnosing benign and malignant endometrial lesions. To get an accurate diagnosis, morphological characteristic and arrangement of endometrial cells must be considered in the cytological screening criteria. Previous literature only focused on the morphological characteristic without the arrangement of the cells. In this study, we found that the both criteria between the normal glandular epithelial cells and the endometrial polyps were similar, which were round and oval with same size and equal cell spacing, evenly distributed with obvious two-dimensional flat sheet arrangement. For hyperplasia cells, both simple and complex hyperplasia of endometrium showed obvious hyperplasia of glands. Even though the structure of glands change, the cells look normal under a microscope. In this study, we found that the morphological characteristics of endometrial hyperplasia cells were still similar, although the number of epithelial cells were significantly increased and the cell spacing was significantly reduced and were still arranged in a 2D flat shape. Atypical hyperplasia is a precancerous condition, an important factor for the progression to endometrial cancer and often seen in a complicated endometrial hyperplasia patients. In this study, we found that the criteria of atypical glandular cells were changed. The nuclei increased and the nucleus-cytoplasmic ratio increased, and the extent of nuclear enlargement was within 3 times. For the arrangement, the cells are crowded and overlap with each other, and the 2D flat shape distribution has disappeared, showing a 3D arrangement tendency.
Accurate cytological interpretation of endometrial carcinoma relies on both morphological characteristic and arrangement differences from atypical hyperplasia. A critical step is the evaluation of nuclear characteristic, particularly nuclear size. There are 2 types of nuclear enlargement. Firstly, nuclear enlargement of 5 times or more compared to surrounding benign or malignant nuclei is highly suggestive of adenocarcinoma. Enlargement between 3 to 5 times indicate likely adenocarcinoma and require further evaluation. Within our research, a total of 17 cases were classified as adenocarcinoma based on nuclear enlargement of more than 5 times. Notably, 2 of these cases had been previously diagnosed as severe atypical hyperplasia on histological biopsy, while cytological findings correctly indicated adenocarcinoma. Cases showing 3 to 5 times nuclear enlargement, 26 samples were analyzed. Among them, 22 were identified as adenocarcinoma and 4 as atypical hyperplasia. As what have been mentioned before, there's additional confirmation features when closer observation have been done, especially when nuclear enlargement 3 to 5 times is observed. The presence of additional features such as large multiple nuclei in the nucleus and large cytoplasmic vacuoles containing neutrophils, cells displaying this characteristic should be classified as adenocarcinoma. In addition to assessing individual cell morphology, evaluating cellular arrangements provide crucial diagnostic information. Although cytology does not directly capture tissue structure, the patterns of cellular arrangement can reflect underlying histological structures. First one, as shown in figure 1.d, which is multi-stage papillary arrangements. Multi-stage papillary arrangement refer to 3-dimensional bunching or multi-layer cellular clusters that resemble papillary structures seen in histology. This pattern resembles complex tissue structures at the cellular level and serves as indirect marker of adenocarcinoma. Next hidden cell arrangement term, the lobulated arrangement. It refers to cell clusters that divide into rounded lobules and often separated by indentations. This arrangement was previously unreported. However, 18 cases of adenocarcinoma are identified and characterized by this cell arrangement. At low magnification, cells may appear as a single cohesive cluster. However, upon a closer observation, these clusters demonstrate subdivision into multiple smaller interconnected cell groups. Next hidden cell arrangement is the escaped arrangement. It was identified as the most easily missed pattern in the study. The characteristics include a few cells separating from the main cluster and cells arranged in shapes resembling a bird tail or chicken feather.
Last but not least, let's look at the summary for this video. Cytological diagnosis of endometrial lesions relies not only on the assessment of morphological characteristics, but also requires careful evaluation of cell arrangements. Firstly, let's take a look at some diagnostic parameters which are easy to understand and recognize. The first one, significantly enlarged nuclei. Secondly, large and numerous nucleoli. Next, large vacuoles containing neutrophils in the cytoplasm. And don't forget a multi-stage papillary arrangements. The next one are cell arrangements that is often overlooked that lead to misdiagnosis of endometrial carcinoma. The first one is lobulated arrangements. It is cell clusters that are dividing or separating but still maintain some connections. The second one is escape arrangements. It is individual cells that have detached from the main cell cluster. The characteristics are the cell has elongated nuclei and is also scattered and isolated. All in all, liquid-based cytology or LBC is a minimal invasive method and effective to detect and clarify endometrial lesions, and it offers
advantages like rich cellular components, and it is suitable for most patients. For example, in the picture here, the sample collected contains a good number of cells, which make it easier to analyze accurately. And that's all. Thank you for listening, and we hope you enjoyed our video.